Hey guys, Lauren here. So I had a request to make a video about the psychiatric evaluation before weight loss surgery, and I just wanted to make it really quick and simple. What they're looking for when you have a psychiatric evaluation is to see that you're capable of actually taking care of yourself after having surgery. They want to make sure that when they send you home with your new tiny baby pouch, that you are in control enough to not rip it open with food and drink. Um, they want to make sure that you're mentally competent and able to actually have this surgery and make healthy choices afterwards. Um, they asked me about my history and why I wanted to have surgery, and they asked about my mental history. I was very open and honest with my evaluation. I told them about my depression and my medication, and I told them about why I stopped taking my medication, and I told them about my anxiety, my PTSD. But also we had a very long talk about why I wanted surgery and how it was going to change my life. And by long I mean like 15 minutes, so it wasn't that long. Um it was really simple and to the point and easy, and it's not like a big deal. It's not a big deal. I mean, as long as you can take care of yourself and you're mentally competent and you're doing this for the right reasons, you're going to pass your psychiatric evaluation. Um I've actually never heard of anyone not passing their psychiatric evaluation, and for better or worse, that actually might not be a good thing, but don't, because there are people who pass with flying colors and then don't take care of themselves afterwards. I'm sure there are plenty of people who don't pass the evaluation because of nerves or that you're not ready. But keep in mind, if they decide that you aren't mentally ready for this step, keep working on yourself, because they're not out to get you and they're not out to cut corners. This isn't like people, like your insurance might try to stop you from having surgery because they just don't want to pay for it. The psychiatric evaluation isn't going to stop you from having surgery for any other reason than because you aren't ready to have surgery. So just keep that in mind. If your psychiatric evaluation doesn't go well and they don't approve you for surgery, then take that as a sign that you need to have some real time to work on you. Get some therapy. Um, please seek out counseling. And it's not a bad thing. Counseling is amazing. Like, I've seen therapists on my own because I felt like I needed it. And that doesn't mean that there was anything wrong with me. Um, I did see therapists that weren't helpful, but sometimes you have to keep trying and finding new ones until you find someone who helps. I Once I actually sat down with an MFT, it's a marriage and family therapist, and she and I had long talks. Everything was okay. I did have to see a psychologist and a psychiatrist to deal with my PTSD, but that's because that is an actual mental illness that needs to be dealt with by a doctor. Um, Other than that, keep in mind, just be real, be you. You can be nervous, it doesn't matter. And funny little story, when I had my psychiatric evaluation done, I was so nervous. I sat in the waiting room because I didn't even know I had to do it until like the week before. And I was sitting in the waiting room and I was freaking out. And I go in, I sit down, and I'm talking to this woman. And we got along great. She had weight loss surgery herself. She was telling me about it. We were talking. She was like, "Yeah, you're completely ready for this." So I walk out of there just completely light and excited for my surgery that was only like a month away. And then I go to walk out the door, and for some reason, it was like one of those just glass doors that you're supposed to push to go through. Um, I missed the door, and I went smack into a window, like a wall, ceiling to floor window. Just my face was like smashed up against it and everything. And I was just thinking, oh my gosh, I am in a psychiatrist's office right now for a psychiatric evaluation, and I'm running into windows. Like, I was terrified, but everyone just was really cool about it, and I didn't have any issues, and I got a clean mental bill of health for my doctor, and all was well. So after all the things that you're doing, like, honestly, as long as you're mentally okay, the easiest part is a psychiatric evaluation. If you do have some mental illness, make sure that you're being treated, and you're being treated by a professional before you go in for your psychiatric evaluation, because they want to make sure that you're healthy. And there is absolutely no shame in having mental illness. No shame at all. But make sure that you're getting help, because there are times when, we can't control it ourselves. When I finally broke down and got some therapy for my PTSD, I felt like failure. But, what I learned was it is a struggle every day living with PTSD. It is absolutely a struggle. I haven't talked about why I have PTSD, but there was a very, very, very traumatic event that happened in my life that caused me to have major flashbacks, PTSD issues. And getting help was a huge relief, because I realized there was nothing wrong with me. It's just my brain, the way it works now, because of that trauma. I have to go about things in a little bit of a different way. I don't take medication for it anymore. It's been long enough that I can handle it. I had enough therapy that I learned to deal with it. There's nothing wrong with getting help, because it helps you in the future. There's nothing wrong with medication. Just keep that in mind. Medication is not evil. It's not horrible. It's just some people need it and some people don't. And there are some doctors who don't give it when they should, and some doctors who do give it when they shouldn't. And as long as we stay proactive about our mental health, all is good. Thank you for watching my videos. I'm going to try to be making them once a week from now on. Since I made 5 this week, I figure that makes up for the past, 8 months of making like no videos. I'm going to try to do one a week. Make sure you post down below what you want me to talk about, and I'll make a video the next day. Thank you for watching. I look forward to hearing from you, and very best of luck.